Welcome. Thanks for having me. My name is Dr. Jessica Feldman, and I'm here to talk to you about expanding DBS access in the community and general neurology world. I'm a board-certified general neurologist with Penn Medicine. I've been in practice now for 20 years. I started adjusting deep brain stimulators in my practice in 2021, and I'm here to talk to you about the benefits of general neurologists feeling comfortable with adjusting deep brain stimulators and how it really provides a benefit to your patients, to your practice in general, and to our communities. We're going to talk about how the Boston Scientific Illumina 3D programming is expanding patient access and making it more user-friendly for general neurologists to feel comfortable with programming, and DBS therapy and how it's efficacious in Parkinson's and essential tremor. I'm going to talk about DBS therapy care gap and why expanding access is important and how you as a general neurologist can help with the expansion of access and feel comfortable with it. I'm going to talk about the Illumina 3D programming and how it makes it easier for you as a general neurologist to be able to program and to feel comfortable with programming. We're going to watch a video on the 3D programming, and I'll go over a little bit about how it works. We're going to talk about good patients to screen for DBS therapy and how it's changed my practice. This is a slide that talks about the DBS unit itself, and it is a three-part unit. You have the lead that gets implanted into the brain, and there are three areas that we implant depending on whether you're implanting for Parkinson's, for essential tremor, and what symptoms you're targeting primarily. Then there's a lead wire that comes out, feeds down through the scalp, through the neck, and attaches to the battery that's put in the chest. It's a very small incision for the most part that the surgeons do. The lead itself, you can see a picture there, is a very small unit that goes into the brain, and it has multiple contact points that allow you to change where you're stimulating. For the most part, it's a very small incision with a very minimal head shave for the patients. And then you have the battery that's put into the chest, but the battery isn't just a battery. That's actually your brain for the unit. That's what sends the signal through the lead wire up to the lead itself. Some facts about DBS: it is FDA approved. They are well reimbursed by Medicare and other insurances. Unlike other procedures that are used for essential tremor, Parkinson's, thalamotomies, this does not actually destroy any areas of the brain. It is reversible, it is adaptable, and if you absolutely had to, you can actually remove the entire system. The newer DBS models are all MRI conditional. It is a proven and durable therapy. So in studies, we've seen that patients who have DBS get 6 additional hours of on time, 51% improvement in the UPDRS scale. That is a huge improvement. And we saw sustained motor improvement for 5 years in the studies that were done. And I see this in my practice where oftentimes when patients first get their stimulator, they have to come in, they have to get an adjustment. But once we find that kind of sweet spot adjustment, I have patients who come in once a year. I have some who come in every other year, although I'd like to see them a little more often because they're doing so well. Compelling evidence to use a deep brain stimulator in essential tremor patients. 100% of patients who had a deep brain stimulator reported a perceived improvement in their symptoms in 1 year. They've reported that they've had 9 hours of tremor reduction post-DBS and then 12 months of clinical improvement in the quality of life rating scale. Patient satisfaction, there have been over 250,000 units implanted, so that's important to know that this is not a new procedure. This is not experimental. We have a lot of real-world evidence, and 96% of patients report that they have satisfaction, and the majority wish they had gotten DBS sooner, and I hear that over and over from my patients.